Everybody, it's Dr. Eric Balcavage, and we're back for another edition of the Thyroid Answers podcast. And as always, I have my co-host, Dr. Erica Riggleman. Hello, Dr. Riggleman.
Hello.
She's hanging out in Winchester, Virginia, and we brought with us a special guest today, a groupie from some of the conferences I go to and a fellow chiropractor, Dr. Emily Hecker. And Dr. Emily Hecker is going to talk to us today about her unique look at what's going on in the world of functional medicine and how she is kind of into this thing called the ketogenic diet and ketogenic lifestyle and how it's helped her and transformed her life a bit. But how you doing, Dr. Emily?
I'm great. Thanks for having me, guys.
Yeah, we're glad you're here.
Happy to have you. I bent her arm or twisted her arm. It wasn't hard at the ShyCon conference, and so we got her on. So we welcome you to the podcast. And what we're going to do is kind of walk through a process here, ask you some questions, and you're going to fill us with some knowledge that our listeners, both docs and patients, can glean some knowledge and get smarter. Okay?
Fantastic. I'm looking forward to it.
Awesome. So with all of us being chiropractors, we all start out with, going through the structural process, going through chiropractic school. How did you transition from just being a straight chiropractor to what you're doing now more in the functional medicine realm? And what type of people do you see in your practice?
Yeah, no, great question. So this is a second career for me. I've always been a science nerd. I went to school for meteorology and aviation.
Wow.
And you know what? I can't take enough and I need more. So God was leading me down the path of health. And at 26, I ran my first marathon and got me into the chiropractic scene. I didn't realize Logan College of Chiropractic was 6 minutes from my house. Okay, so I'm like, this is just a sign here. So I went to school for chiropractic, but thought, you know what? Hey, I don't know the business side of this. I don't know how to run an office. I went to school for meteorology and aviation, and I want to learn this. So I actually took a mentorship with a local doc who was into functional medicine, and I had no clue what that was. So I said, you know what? I'm not going to be one of those docs that sells supplements. That's just not up my sleeve. I want to actually help people. And so I went to school, and I realized, well, this stuff is cool. People are coming in the office with all these health issues, and they're leaving actually fixed. And the medical model was not addressing it. And so that's what stimulated me before I actually even started chiropractic school. So I was doing an internship with a local functional medicine doctor and fell in love with it. And I loved the science. I loved it to dig deep. So even in school, when I was going through it, I started a functional medicine club and started working. All my classmates know I'm the functional medicine nerd. And so I've just expanded on it. And now that's where my practice is, I work part-time, but functional medicine is my passion. It's my love. So yeah, that's how it basically got started, how I got into doing functional medicine. Yeah.
So that's interesting because a lot of us got into chiropractic or functional medicine because of need, right? I know I did. I got into chiropractic care because I was injured in a car accident, and traditional medicine, which I was in at that point in time, wasn't able to help me. And I met a chiropractor, and he was able to help me. Then I went to chiropractic school, and this is great. And then I started doing functional medicine, but I didn't really get into functional medicine until I had my own health crisis, and that really started making me dig into what was going on from a chemistry standpoint and get back to my roots. But did you have any health issues that really kind of drove that functional medicine aspect, or you were just, hey, I love this stuff?
I just kind of sat along for the ride, and what got me into chiropractic was I did have back issues, and I was raised in a family where if you're sick, you take medicine. You go to the medical doctor, you take drugs. And I was the black sheep of the family. But going to chiropractic school, I was not raised in a chiropractic environment, and I did that, and it was amazing. Chiropractic helped me tremendously with my low back pain when I started getting a desk job after college. And so, but as far as functional medicine, not really. I mean, I've seen a lot of support with it, even with my kids, because I have a 4 to 5-year-old, 2 boys, and we've had some challenges for behavior and just all kinds of things. So I've seen it more with my family, and it really drives me with my family too, because as I got into this, my mom has autoimmune everything, and I'm next in line. to get it.
Yeah.
It's hereditary. It's coming down my line. So I'm doing every day that I'm in practice and I'm working with patients, I'm saying I'm preventing what's going on because it's in my family. And so it's very motivational just to sit down and meet with so many people and realize, wow, this is next on my list, but I'm doing everything preventative to prevent it from going out of hand. So yeah, not necessarily, personal yet, but.
Well, you don't want it.
Right.
Yeah, that's definitely a great story. And so speaking of autoimmune issues, you work with a lot of mothers, correct? And babies.
I do.
And so do you often see that, so this is a thyroid podcast, do you often see that a lot of these mothers have autoimmunity, or that it starts after they give birth to a baby that their autoimmunity begins?
Erica, yes. And that's what really triggered the transition into functional medicine with that. This drove my passion, because I realized that so many women, they developed autoimmune diseases after their first baby or second baby. And it was a trigger, and it was a pattern I was seeing clinically all the time. Man, what is causing this? So that's what dug me to drive into this, as far as how many women are developing these autoimmune diseases after they have babies. So that's, this whole trigger between what's going on in pregnancy, what is happening in the woman's body in pregnancy that's causing these autoimmune conditions to flare up. So that's a huge component. And I started a whole system business actually in St. Louis that focused just purely on mothers.
Oh, wow.
Purely mother. Yeah, and it was looking at, from a doula standpoint, from a medical doctor standpoint, from a psychiatrist. There's postpartum depression. There's all these things associated with pregnancy that really got me into figuring, okay, what's going on? That's awesome. When I started digging into even the thyroid and seeing that, man, there's a TH1, TH2 shift. There's this dominance, this shift within the pregnancy, and with even in that fourth trimester after you have the baby, it's all hell breaks loose, basically, within that woman's body.
Yeah, I definitely see that in my practice too. Most of the women that come and see me are, a little bit beyond having children, but they always say, I wasn't the same after I had my first baby or my second baby, or I even struggled to get pregnant is another thing. So I often see a lot of infertility. I don't know if you see a lot of that in your practice as well.
Yeah, absolutely. And that's one of the key patients that I work with is they seek me out. They're looking for, they have infertility issues. And so they find me. Now I'm a methylation nerd, so I follow Dr. Lynch, and that's what also triggered getting into this as well, because I was seeing, even just freshly out of chiropractic school, I would be adjusting the baby, and the mom would say, oh, I have MTHFR. Oh, and my baby has tongue tie. Fast forward to the next patient. Oh, I have MTHFR. Oh, my baby has tongue tie. And it was just like, okay, I'm hearing the same story over and over again. What is up with this? So that's when I started giving my patients folate. And what happened was that it tore them up. I didn't see the great results that people typically have. And I don't know if it's because I have more of a chronic-based patient. I have more chronically immune suppressed patients. And so they're just more likely having these issues. But, giving folate is not the answer. We got to dig deeper for a lot of this stuff.
So when you talk about, because I see the same thing, and I have my own kind of thought process as to why we see more autoimmunity after pregnancy. But what do you think is that tie for why we see autoimmunity start to kick in, especially thyroid issues, autoimmunity towards thyroid gland kicking in post-pregnancy? What do you think what's the tendency? Why do you think you see that link?
That link, yeah. I think there's a lot of answers to that, but stress on the body is absolutely huge, and that's going to tear up, and the biggest thing is gut. I'm sure in thyroid world and on the podcast, we talk about gut so much, and it's a key factor. And one of the biggest things I've actually stumbled on is just researching a little bit more into histamine intolerance, because that is huge. I have some theories here that I'm excited to talk with you guys about. But it's stress related, that stress, that cortisol release, which is screwed up, is basically going to thin out lining of that gut, and it's going to cause that mucosal layer to deteriorate. It's going to break apart those microvilli. It's going to do damage to them, and then it just puts them at higher risk for developing more microbial infections. So a lot of it starts with stress and deteriorated gut integrity.
Yeah, I would agree with that. And I also kind of think that to some degree, there's a normal swing to be more hypothyroid during pregnancy and during that first kind of right when a female gets done having their baby. There's that kind of slowing down the metabolism, I think, to some degree, so that we can produce milk and do the things that we're supposed to do. And if we're running around and going like crazy, our metabolism's running, maybe that plays a role in decreased milk production. And again, these are all just theories and thought processes. But if you think about it, maybe that makes sense to have a little bit slower metabolism during that phase, because it would help with nurturing and producing what we need to do, storing fat, being able to produce some of the things we need for the baby. And in our fast-paced world, where we're already stressed out, right? We already have issues. Maybe one of the ways to kind of slow that whole process down is to create some damage to the thyroid gland to slow the process down. There's some papers and some research that showed, like, during famine, especially in the Irish community, when there was famine, there was a great tick up in autoimmune problems as a result. They believe to trigger slower metabolism, to slow the metabolism down, because there just wasn't food. And if there's not food, or you're not eating sufficient nutrients, or there's a greater demand to potentially store nutrients and slow metabolism, maybe this autoimmune process isn't an accident per se, but really part of a natural process to slow the whole metabolic state down a bit. The problem maybe is that with all the other stressors going on, our ability to really slow that, to kind of revert that process or stop it and halt it, gets compromised. So there's this thing that the body makes, there's two theories, I guess, that the body makes mistakes and attacks itself by, and it's an accident, or it's just the way things go. Or if you believe in the intelligence of the body, maybe the body's really trying to protect itself or protect what it's doing. I don't have the science to back it all that up, but that's just a thought process of mine.
Yeah, that's really interesting. I think it's a great thought process. You got to link these things together, and we don't know all the answers, but we can theorize and we can guess, and it's a really interesting thought. Yeah,
so it's, you think about that. If we're trying to slow, if you have a female that's run, and her metabolism's jacking way up, what's her ability to make a lot of breast milk and be able to feed and nurture her child? Is it going to be where it needs to be? You see a lot of women who have chronic stress, whether it's physical, chemical, emotional, or microbial. They have difficulty producing milk and keeping up with what they need to do for their child. So I think that may play a role, but we'll see. That's for down the road when we can kind of figure some of that stuff out. But let's tie in gut, because I know that's a thing we geek out about, and I know it's something that you're interested in too. So I know you do a little bit, maybe do some testing on evaluating gut health and gut function, because the state of somebody's body is really important prior to pregnancy. And we've talked about this on prior podcasts that, unfortunately, when most people are thinking about getting pregnant, they are not thinking about what their nutrition is. They're thinking about something totally different, right? And then they go, oh my, I'm pregnant, right? And now the car's already out of the garage, and now most of these people are in catch up, trying to get themselves healthy to really have a healthy child. What are the tests that you typically like to look at to get an idea of what's the state of somebody's gut health and what that status is?
Right. Yeah. There's a lot. I like different testing options, but definitely a micronutrient test is very valuable to me to see what the intracellular levels of those nutrients are, especially if they're planning on having a baby. Seeing what the B12 status, seeing what the folate, seeing how they're detoxifying with the glutathione, the choline. So the micronutrients on my list. Also, something that I've more recently started doing and connecting the dots with is a test from Dunwoody Labs. I don't know if you guys have heard of this one. It's this intestinal advanced barrier assessment, which measures histamine. And it looks at DAO. The DAO enzyme stands for diamine oxidase. This degrades the histamine. So I wanted to just chat a little bit about what the role of histamine in even pregnancy and getting the body ready so it won't reject a pregnancy. So if there are infertility issues, they're trying to get pregnant, we need to make sure, we got to assess the integrity of their gut, make sure they're not going to have a lot of histamine that will actually break down and deteriorate that embryo when they first get pregnant, because that puts them at a higher risk for having infertility if they're having histamine release. And it goes back to the gut. So if the gut's, not working great, they have more zonulin. Zonulin is a protein that really gets impacted, kind of breaks down that barrier, that tight junction between those mucosal cells. So zonulin can actually be measured on this test from Dunwoody Labs. They're in Atlanta. And there's a couple other labs that do that, but I like their specific panel because it looks at zonulin, which will measure that. It'll look at DAO, it'll look at diamine oxidase to see what the patient's level is with degrading that histamine. It will look at histamine levels. If they have high histamine in their body, that's going to put them in a higher risk. So if they don't have enough diamine oxidase, they're going to have a higher risk for miscarriage because it's not going to be able to break down that inflammation when they do get pregnant. So I think this is a really interesting test to bring in to the infertility scene, the pregnancy scene, to assess that. And, the placenta is one of the biggest producers of diamine oxidase.
Right. So let's break that down a little bit so that we can kind of work our way through it, because there's a lot of important stuff you just said there. So if we had a listener who's trying to get pregnant and they've struggled to get pregnant and they come to see you, what's that first step that you're looking at for them? Is it, hey, let's get some testing done? Are we looking at you're evaluating their diet? Walk us through what you would do in general with somebody who's struggling with fertility issues.
Right. We got to start with diet. I start with diet with everyone. That's huge. And I make everyone track it. We got to know what's not working so we know how to fix it. So we got to track, we got to get data. We're in data collection mode. We got to gather some information so we know what's not working for you, especially if they're trying to get pregnant and they have recurrent miscarriages, or if they're just wanting to get healthy enough to get pregnant. So we got to track with dietary. That's absolutely huge. Start with diet, and then we got to assess what's going on. We know that the intestinal barrier is a very supple, rich environment that can be very fragile for damage. So we got to help start rebuilding that digestive system, make sure that works, and then go in to assess the nutrient status. Everyone's a little different when they come in, because you got to take everyone's just background into account. You got to look at the full history with that. But so those kind of the basics of where I start. Definitely nutrition, decrease that inflammation, cut down those carbs, because sugar is so damaging to the body, so damaging.
That's awesome. I love that you don't have a cookie cutter program, which a lot of doctors out there, they're just looking at symptoms and trying to manage the symptoms, but you actually look at the patient as a person, as an individual, and customize based upon their needs. Do you do any sort of hormone testing as it relates to infertility stuff as well? Yeah, absolutely. I love the Dutch test. I love that dried urine. Man, I love explaining it to people, and we get some really cool stuff, especially, and this is interesting. I don't know if your listeners have heard of this, the dried urine test for comprehensive hormones. And I think you might be having Dr. Carrie come on. I'll love that later. She's amazing. Yeah. With Dutch, but that they have two different tests there. And one is just that initial test that you do in that luteal phase to assess, the estrogen, the progesterone, and everything there. But that cycle mapping, that is valuable. Cycle mapping, this is cool because they actually get to pee on a little strip of paper every other day of their whole cycle. And you're getting data. I love data. I love that because you're getting information. And I had one patient once that we were opting just to do the initial hormone test, and we decided to do the full shebang, the big one, to look at the full cycle. And I'm so glad we did, because the one day that it actually looked beautiful, the progesterone, the estrogen looked gorgeous, was the one day that it would have been for that complete, that initial one, but it was way off. I mean, her progesterone, her estrogen was way off cycle. She was having these major headaches. So I'm so glad we did the full cycle mapping just to look at the whole trend of what the cycle was doing. So yes, there are definitely some hormone tests that I do. That's awesome.
So if we look at, so we got the patients coming in, they're struggling with their fertility issues. You're going to modify their diet, say, hey, let's evaluate your diet. Let's see what's going on. Let's make sure we're getting good food into the diet. Take a look at the rest of their stressors and lifestyle factors, which are things that Dr. Erica and I talk about all the time. Then you're going to start to potentially run maybe a blood panel, find out what their thyroid status is, what their inflammatory status is, find out what's going on with blood sugar levels like that. And if they've got challenges, maybe they don't have gutty symptoms, but you're looking at histamine as a potential trigger for problems with pregnancy. If somebody said, do you find that you often run that Dunwoody test with somebody who's got infertility issues? If they have GI symptoms, it may be a no-brainer. You may say, yep, let's run it. But if they don't have GI symptoms, because a lot of our patients say, well, I don't have GI problems. And because they consider how their bowels function and move, their gas, their bloating, their lack of pooping, a normal factor for them. So if they said, I don't have GI problems, would you still potentially run that test if they've got infertility issues, and why?
Yeah. Actually, yes. And I just don't think there's a lot of information out there in relation to infertility and even just histamine information, because I mean, going back to that placenta that produces that diamine oxidase, this is kind of interesting, but my hypothesis of those, who have autoimmune disease, so many of your listeners have like a Hashimoto's, like an autoimmune thyroid disease, that may actually the symptoms go away when they're pregnant, right? Do you have those patients where like
they feel the best when they're pregnant?
Right. I see that so much. And, why is that? What do you guys see for that? What do you see for that?
Well, I think we both would say it's the shift in what's happening with thyroid, with the immune system, right? Mm-hmm. And so we see changes in histamine response. We're seeing changes in immune response. And as you were saying, it's just so our listeners know, histamine is a normal, natural substance that's released when there's an immune response or an allergy response. It's natural. It's normal. Histamine is also released by food in the GI tract, and the body makes it, and then it degrades it. You need to have histamine. It's a normal thing. It's like the three little bears, right? Too little, not good. Too much, not good. Just right is where we want to be. But if you don't have appropriate histamine, there's a lot of things that can't function well, including stomach acid production it goes down if you don't have histamine. You want to have a histamine response. But if it's excessive and you have chronic allergies, sinuses, headaches, migraines, gas, bloating, pressure, those types of symptoms, skin irritations, then you probably have an excessive issue. And there's two things, as Dr. Emily was referring to. One of those is diamine oxidase that helps break down histamine. And primarily that's made in the gut. When we eat, our foods release histamine, and the diamine oxidase in the gut kind of keeps that in check and breaks it down. Some people have genetic predispositions to something called SNPs or polymorphisms that reduce their ability to break down diamine oxidase, so they can get more histamine absorbed into the body and get more runny nose, itchy eyes and stuff after they eat certain foods, especially the higher histamine foods. One of the reasons I believe Dr. Emily likes to run that test is that some people who have gutty issues, have leaky gut, damage to the intestinal lining, the diamine oxidase is produced in the villi of the intestine, and if they have leaky gut or damage to the intestinal lining, then they aren't going to produce the amount of diamine histamine they are supposed to. And then you can get more of a histamine response. We see people also, there's an enzyme called HNMT, which is histamine N-methyltransferase. Not that anybody besides probably the three of us is that concerned about it, but it's a methylation reaction. So it requires B9, B12, and these things called methyl donors to break down the intracellular histamine. So a lot of people who have allergies and sinus problems are unable to break down histamine, or they have an excessive histamine response. But during pregnancy, as Dr. Emily said, the placenta actually produces about 500 times the amount of diamine oxidase. And so if you typically have allergies, sinus problems, excessive histamine issues, during pregnancy, you get all of this diamine oxidase produced, and it quelches all this extra histamine. So people feel fantastic. All my allergies, all my sinus problems went away. My skin itch went away. It was awesome. If I could just stay pregnant and then not have to take care of any kids, this would be awesome, right? But that's not the way it happens, right? So it is, I think it really is an important little, like, ding, 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 when you talk to somebody and you do their health history and they say, I've been pregnant, I was terrible after pregnancy. Yeah, but how were you during pregnancy? Oh, the best I ever felt. That's a huge clue. They got some histamine issues, and we got to dig in as to, A, what's triggering it, why can't they break down the histamine, and how do we go about fixing it, right?
Right. You know, something else that might be a good trigger is also what happens after they have the baby, after the placenta has been delivered, after it's been removed. So you can take that big source of that production of the diamine oxidase out of the body. What's going to happen postpartum? What do we see in so many people? Depression. It's postpartum depression. I mean, that's huge. And diamine oxidase is gone, so that's going to lead to depression and anxiety. That's another thing, you know. Wow, this postpartum, yes, it's a methyl issue. It's a methylation. We got to support that with the B vitamins, the folate, the B12. But what does that do? That's going to nab that intracellular histamine. So we're supporting that intracellular histamine. What if we were able to go in there and bring in and still support that extracellular, that diamine oxidase after the baby's been delivered to help with the postpartum depression? You know, that's an interesting thought too.
So there used to be, Dr. Lynch and Seeking Health used to make a product that contained diamine oxidase, right? And I love that product. My patients love that product. It was a great option to use. And unfortunately, somebody bought the patents to that, and they're making their own product now, and only their product, and they won't release it for anybody else to make stuff. And I've had a bunch of patients try and use it, and I'm telling you, they do not get the same benefit from that product that they did from the product that we used to get from Seeking Health. Have you guys used that product at all?
I haven't used it yet.
No.
I haven't heard that it's been the best, so I've been reluctant to recommend it yet.
The new product?
Yeah.
No, I need to get a hold of you and see what that is to test it. But the previous product, the diamine oxidase, man, people would come in my office and have a major pizza engorgement at Whole Foods and come in with, you know, gastric reflux and sneezy nose, and I'd say, take a Dow. And man, that would be gone in like 10 minutes. So I love that previous product, and so I know we're in the practitioner world waiting on something that hopefully will get released.
Yeah, so I think the tough part, obviously, quercetin is something that you can utilize, and I use a product called All Clear. I think it's from Research Nutraceuticals or something like that. Research Therapeutic Research. I have to look it up, but it's called All Clear. It's with a Q because it comes from quail's eggs, and it seems to do okay. But I really like that diamine oxidase. That was a porcine-based product. But again, it's going to be a while till we probably see it. I'm not sure what's going to happen, but not happy about it. So you've got what are you using now to try and help these people who have the histamine issues? What's your go-to?
Yeah, so we're just going to we're switching to just rebuilding. Well, we're still rebuilding the gut, but immunoglobulin support is huge. That's going to help just bind up those zonulins and protect it. So that's a mucosal barrier support. So immunoglobulin support's a big one. Quercetin is a huge one. You know, I like orthomoleculars. They have a great dehist. That's fantastic. I like quercetin, vitamin C. The liposomal vitamin C is also fantastic because that's going to help degrade that histamine as well. So go in that route.
That's awesome. I'm assuming that you've talked about previously that you're changing the diet. So I know in my practice, I'm preach low carb, ketogenic, gluten-free, dairy-free. What sort of diet are you recommending to a lot of these patients?
Yeah, no, great question. So and this kind of goes with a little bit of my experience too. I started, so I have two boys. I have a 4 and a 5-year-old, and man, after that, and my husband travels for a living. But basically a single mom with 2 kids that are 18 months apart, and I'm going nuts, right? So, and they're boys. Did I mention they're boys? So, but anyway, with the stressors of, you know, post-pregnancy, I crave sugar. You know, I'm a human. I would just eat sugar when the kids would not stop crying in their beds at night. So I was a normal human that gets to come to this, and I needed to just regroup, right? So after the babies, and found a program that actually eliminated, I liked it because it eliminated the inflammatory foods. It was kind of like an autoimmune paleo type of food list here. So I did that, but this is the other thing too, is when this is kind of a little bit my story, when I was doing that, I was seeing a personal trainer. So I was overweight. I was pushing 200 pounds, and trying to lose the weight and get healthier. I was having hand cramps, and I was waiting for that autoimmune to set in, right? And decided that what I wanted to do is do paleo. So I ate paleo, but I wasn't personally losing the weight. So this goes to the weight management. And I was becoming toned, but I could not drop that fat. It was that fat that I couldn't lose. So what I did is, this particular program, they talked about the quantity of the food that you're eating. And that's really the difference between the paleo and a keto way, is that paleo really acknowledges the types of foods that are anti-inflammatory, which is great. It talks about those, but it doesn't talk about the quantity of those foods that you should be consuming. So that's what really got me in understanding and just digging a lot deeper into understanding how the paleo, how the ketogenic world works. I lost about 50 pounds in 3 months.
That's awesome.
Maintained it and fell in love with the science behind it. I needed to understand how this works. How do people lose weight? And they look at ketones, and that's also another hot topic, with the ketogenic stuff, these ketones, these beta hydroxybutyrate. I've been in that world too, testing around with mitochondrial function and everything there. So I know I'm getting off track. I'm just getting into it. But
no, you're fine. But I think one of those things that's probably worth explaining a little bit, you talk about paleo, and then you talked about the ketogenic diet and the quantity of food. So can you elaborate on that? What's the difference for the listeners? Is one saying, hey, you can eat as much as you want, and one saying you should eat restricted calories? Can you explain that a little bit?
Yeah, absolutely. So paleo is the type of foods. So it's good because you're eliminating those inflammatory foods, the gluten, the dairy, the sugars, even autoimmune paleo. If you're autoimmune, if you got these Hashimoto's listeners and they're doing autoimmune paleo diets, but it doesn't address the quantity. How much of that food should I be eating? So it doesn't put you into a more of a ketotic state. So you can still be having high carbohydrate intake with a paleo diet. That's what I was doing, because I was eating a ton of sweet potatoes. I was eating a ton of macadamia nuts, so that's high fat. I was eating a ton of mangoes, that's high sugar. So, I wasn't losing the weight I wanted to. And for me, it was weight loss that I was aiming for, because I didn't have those ratios in order. I was just eating a ton of healthy food, but not the right quantity. So once I understood, wow, you have to actually have low carbs. You got to get the sugar management down. So we got to start tracking with the foods that you're consuming. Even though they're healthy foods, if you're eating high quantities of them, you can still be bugging you down, kind of like gluten-free diet.
Yeah.
Right.
They can still be gluten-free, but they're eating a ton of bad foods for them, if they're not really fine-tuning it. So getting those ratios down is really important, as far as how much protein you're eating, how much fat you're eating, and how many carbs you're eating. So
the ketogenic diet that you're recommending, what's your kind of carbohydrate? Because it can range. I know some people are, get it as low as possible carbohydrate wise. And the other side of the ketogenic is, you could have up to, 5 to 20, grams per day. Where you fall with the amount of carbohydrates to still stay in what is considered a ketogenic diet?
Right. I'm still experimenting with it. Everyone's a little different. Like you say, some people respond better to really low carb versus, moderate carb. And typically I start with a little bit more moderate. So around 50, 50 and below is a true definition of, getting in a ketogenic state. I don't push the 25 grams because it can be hard, especially when you're trying to get those fibrous vegetables in.
Yep.
You got to get those methyl donors in from the leafy greens, those foliage. So you got to account for the good vegetables in there, because I was testing around saying, wow, let's try to get that low carb, but then people weren't eating vegetables, that counted. So there's a happy medium between the two. And especially for weight loss. And this is something that a lot of people do not understand when they read keto. When I come in here and we talk ketogenic, and I call it my AI keto, because for anti-inflammatory keto, I have a specific list of foods. I have a little program that I've designed that are not just high fat, high dairy, because when you type in keto, you're going to get, eat a ton of fat, and from dairy sources, from, whatever it is. And it's not necessarily the route I'm going with the patients. So we need to make sure we're eating from a certain food list that's anti-inflammatory, and really fine tuning those. And also with the fat loss, and this is what people really, I want them to understand, is the fat. If they're consuming a ton of fat and your goal is to burn fat and lose weight off of your body and do body composition changing, you got to make sure that fat is a little bit lower than that protein. You can't eat a ton of fat and expect to lose weight. Fat's high in caloric calories. You got to be in a calorie deficit to lose some weight. So I always make sure the patient's getting enough protein and going a little bit below that with the fat consumption, making sure they're still getting some if the weight loss is the goal. If weight loss is not the goal, then we change things up. Especially if they're trying to gain weight, or they're trying to, get into anything as far as just even tumor and cancer. I mean, ketogenic has so many different approaches to it. You can use it in so many different applications. So yeah, making sure that the carbs are a little bit on the lower end, fats in the medium range, and because you're burning your fat. Yeah. That's what people understand. You burn your fat. That's the fat source. That's where we're still getting that from.
So I think we see a couple things too. I mean, we know that everybody's an N of one, right? So we've got to find that. But I think in general, if we look at general rules for our patients, if they eat real food, well-sourced, healthy, quality food, the best they can afford to buy, they typically need to eat less volume because they're eating better quality food to start with. So if we can get them on a real food diet, that's key. If it's processed, packaged, as a general rule, it's probably not as good for you as something that's all natural, that's in the outer edges of the shopping of the grocery store when you go. The other challenge, though, for some of those people who would say, okay, I just listened to Dr. Emily, I'm going to go paleo or keto, and they go from a high carb diet to a high fat diet, there's a couple things that can occur, right? So number one is they're going to probably feel like crap, right? So they call that, in the world of keto world, they call that the keto flu. So for those people who are thinking about doing keto or have done keto and said, I didn't like it because I felt terrible, can you explain a little bit about what the keto flu is?
Yeah. This is one of my favorite topics. So what happens when you decrease your carbohydrate intake is your glucose levels are going to go down. When the glucose levels go down, it's going to mirror that with the insulin. The insulin levels and glucose are going to go down. What that does is it tells your kidneys, it's a signal. Your kidneys are going to say, hey, pee out a ton of that extracellular water. Pee out that water. So you're going to have to go to the bathroom a lot, especially that first week, the first 3 days or so. And it's going to be waking you up at night. You're going to be dumping a ton of water. You're going to be urinating. So when you have kids, when they lose a lot of water, whether it's through diarrhea or vomiting, what do us as adults do? We get Pedialyte. Yeah, right. We know that we need to make sure we get them rehydrated. And with rehydration, we need those minerals associated with that. So same thing in adults. We think of it with kids. Oh, wow, they're vomiting. They're losing fluids. We got to bring that back in. But adults are the same too. If you sweat a ton, if you're losing a lot of water, if you're constantly thirsty and you're drinking a ton and peeing a ton, urinating, you got to bring those electrolytes back in. So that's a huge, huge thing, is that we got to bring the sodium, the salt, the potassium, the magnesium. We got to bring those cofactors back in so we can help balance it. That's some of the symptoms of keto flu are increased thirst, muscle cramping, headaches. Man, I get horrible headaches when I'm getting back into a ketosis. I want to lick the salt off the ground if there's snow on the ground. It's a huge craving.
Hello, snow.
Yeah. Not yellow snow. But that's some of the biggest things there is making sure you get those electrolytes back in.
So they could become dehydrated. They could lose their electrolytes. Another key factor could also be that they're a conditioned sugar burner. And if they're a conditioned sugar burner, they probably have some chronic inflammation, right? And so their efficiency of utilizing and burning fat is probably not too good, right?
Right.
So if they are a carbohydrate running machine and you take away the vast majority of their carbohydrates, now they need to figure out where they're going to get energy. Even if they're consuming a bunch of fat, they have to be able to burn fat. And we know that they need sufficient amounts of activated riboflavin and carnitine to shuttle those things into their mitochondria if they're chronically inflamed. Those mechanisms may not work well. So that too can be another reason why they feel like dirt as they go from lots of carbs to no carbs. So that transition is probably one of those things that's important for some people. If they go from a lot to very little, man, that's another reason why I see a lot of people feel lousy. If they make that transition sometimes a little bit slower, and they support appropriately, especially if they're B2 deficient or if they're hypothyroid, the probability of not having activated riboflavin to work on something called their carnitine shuttle can create some issues as well.
Yeah, also don't forget the most important one when adding lots of fat into your diet is going to be disaster pants, because a lot of these patients do not digest fats, they don't absorb them. So if you put a whole flood of fats into the system, it is going to a lot of times stimulate diarrhea, and they're going to have digestive distress because they don't know how to absorb those fats, and so they're just running through the digestive tract very quickly, which can be not a very good situation for most people when they're transitioning. Can leave a bad experience with it.
So we could talk about that. We could tie that into the gutty stuff too, because if they have, especially if they're female and they're overweight, they probably have some extra estrogen, right? Mm-hmm. And that ties into our histamine stuff, because as histamine and as estrogen goes up, histamine has a tendency to go up as well. And as we've talked about on the podcast, it ties into bile physiology. Estrogen inhibits bile salt secretion, inhibits the sphincter of Oddi, so pancreatic enzymes can't get secreted. So now you put all these fats into a system that doesn't have the bile acids and salts to actually break it down. You can't absorb them. One of the other things that can happen there is if you don't have the bile acids to break the stuff down and help it absorb, then what happens to the bile acids is that the calcium, especially from our green leafy vegetables, is typically bound to oxalates. And so they have calcium disassociates from the oxalates. Calcium binds to the fats. It goes out in our poopy pants, right? And then the oxalates, especially if they have any level of yeast overgrowth, can get absorbed into the system. Now we've got oxalate sensitivities, brain fog, fatigue, joint pain, and we've just compounded the system. So I think for most people who want to make a transition to a healthier lifestyle, keto lifestyle, by all means, there's lots of resources out there to do it. But if you start doing it and you have some challenges, you really want to find a functional medicine practitioner, get your gut looked at, make sure you have a micronutrient panel or some way to assess your B vitamin status to make sure you're able to do it. Something like an organic acid test is a great test, or organic acid amino acid panel is a great way to assess what's going on with the overall chemistry to see what's going on. A poop test or the test from Dunwoody Labs, the GI function and barrier, because you can, while the ketogenic diet can be great, the paleo thing can be great, if you make that transition and the gut health is not where it needs to be, you can really create some challenges for yourself. And a lot of times the real healthy foods are loaded with histamines or drive histamine response, and so people can really feel lousy just with that transition. So there's multiple aspects to it, right?
Yeah, it definitely is.
All right, so we want to talk, there's one other thing that I want to bring up, because I know that I saw once a post from you after one of the Seeking Health conferences, I believe, where you went out with your girlfriends and found the secret recipe. I think you posted it on your Facebook page, the secret recipe to not get drunk and get a hangover. Can you explain that a little bit?
Oh, this was so cool, guys. This was just too awesome. So this was a couple years ago. My girlfriends and I, we got together for an LA vacation, right? You know, and I have 2 kids. I don't drink, but when I do drink, I have a little bit, and man, I respond to it, and it tears me down, and I fall asleep. So I have this histamine sulfite type of response with too much alcohol, and I decided, since I had this new knowledge, since I graduated from college, I need to become armed. I need to bring my good supplementation armor with me. So we went to LA, and we were having some drinks, and my goodness, I could not get tipsy. Okay. I was, and I'm normal. I'm a one type of drink type of girl. I drink it. I can feel it. I'm woozy. But I was drinking margarita after margarita. I'm like, you guys, is there anything in this? And they're like, yes, Emily, there is. And I'm like, I don't believe them. It was just, I was having drink after drink. It was costing me a fortune. And I couldn't feel anything. And I didn't wake up with any hangovers. And I'm like, I don't know what's up with this, but this is awesome. But it was costing me, right? So when I started thinking about it, I'm like, wow, what am I doing? Like, what am I strategically doing to my liver, to my histamine response, to my body? What am I doing here? So I had my list of products that I was actually just helping myself methylate a ton better. I was breaking down those histamines. So I had a gluten phlegm, a gluten product that would help break up gluten, the digestive enzyme, that's a huge component there. I had magnesium. That was a huge cofactor for a lot of the enzymatic processes within the methylation, transsulfuration cycle. I was doing large doses of B12, the adeno. I was supporting my mitochondria like crazy, and I was bringing in that DAO enzyme when we still had access to it in America. And I was taking this on a regular basis for those 3 days I was there, and I couldn't get tipsy. So I realized, man, this thing, what I was doing, when I look back at it, I was supporting my extracellular histamine, my intracellular histamine with my methyltransferase support. Now, I wasn't taking any SAMe, but it was getting good protein. I was eating great, eating paleo, but it was so cool because in molybdenum, that was a huge one. That was another one that I brought in there to help process those sulfites, that detoxification process. But it was so interesting. But this is the thing. I did write a blog post on this, but everyone won't respond the same. That's the thing. It's not one magic pill to get over histamine or to get over, alcohol. But you can look at it as a big picture to say, wow, how can I work this for the better? How can I take B12 for my benefit, to get through these parts if I'm super stressed or if I'm drinking a little bit of alcohol? How can I get this going? So that was a fun experiment that I did.
So you didn't come up with the hangover recovery pill as a result of that, right?
I have not formulated anything officially, Eric. No.
You should. That would be $1 million product.
Yeah, I'll talk to Jason, see what we could do, or Ben, and see what we could do. So one of the keys, I think that was an important post. It was a funny post when I read it, and I remember that post. And the interesting thing is, what did you do, right? Alcohol's toxic. It uses a bunch of enzymes to break it down. And for somebody who's going to go out and have some alcohol, if you want to do it, that's great. But if you're going to do it, taking extra B vitamins is probably not a bad idea, because alcohol is those enzymes that are needed to break down alcohol are going to deplete your B vitamins. So taking a bit of extra B vitamins is not a bad idea. The molybdenum helped you because it helped break down sulfites, right? And most of the commercial grade, especially the commercial wines that are available, are just loaded with histamines and sulfites, right? And it's interesting that alcohol doesn't need a label, right, of what's in it. Isn't that interesting? Yeah. I mean, everything else has a label. And I heard, as somebody who makes organic wine, and the rumor is, and I haven't tried it yet, that when you drink organic wines, they don't have near the amount of histamines or sulfites in them. And they taste a little bit different, but you could drink these guys. You can get a buzz, but there's no hangover, because it is the histamines and the sulfites and the lack and these enzymatic reactions that don't work well that cause you to have all the negative symptoms because of all the toxins that don't get kind of cleared out of the system. But it's interesting that we don't know what's in the stuff that we're drinking, especially the wines. I mean, there's a lot of junk that's in it, supposedly. And so I think it's pretty cool that you noted that. And anybody could almost use that as a healthy tip. If they're going to go out and have some alcohol, it is going to deplete B vitamins. If you're drinking wine or things that have a higher level of histamine or sulfites, which those, especially the wines, are going to have, some quercetin, some molybdenum, some B vitamins are probably things that are going to be helpful the day of. the day after. It's not something you want to just load up tons on, but it could be helpful in reducing or preventing a hangover, definitely.
Yeah, it definitely can. And here in Virginia, we live in the wine country of Virginia. And so you go to a lot of these wineries and you see it's got tons of sulfates in there. It's, they're serving cheese and crackers and, sausage with it. And so you're just loading up on the sulfates. And, oftentimes people come, the next day they feel so terrible, but they often just contribute it to the wine. But you often have to look at what's coming from the histamine from the cheese. It's coming from the sausage. It's coming from the gluten that you may have in the crackers. And then it can be, compounding where you go to these wineries to relax and then you're just doing a whole bunch of other damage, because you're not supporting those pathways.
Right. Now, have you guys heard of those sulfite straws?
Mm-mm.
Yeah.
I've heard of these. I haven't got my hands on one yet, but they're actually straws that you put in wine and stir them with and actually kind of absorbs the sulfites from the wine. It's a product I've heard that's been on the market, but I haven't experienced it myself, but didn't know if you guys have heard those or had patients talk about those.
No, I've never even heard of them.
Yeah, I haven't heard of it. I'm not that big of a drinker these days anymore, but I have to consider that. I know my wife is very sensitive to different red wines. I mean, there's a couple that she feels comfortable drinking, then there's a whole bunch that she drinks, and she won't get half a glass, and she's like, I don't like that. It's giving me a headache, whatever. So some of them are really toxic. And that same guy was talking about the organic wine said most of the commercial wines are made by 3 major companies, and they just get relabeled. So the grapes are from one place, but they all go to 3 central places really to make all these wines, and they just slap different names on them. Mm-hmm. I thought that was interesting. I'm like, that is crazy. But it makes sense, right? We've done that with food. Why not do that with alcohol? I mean, it kind of makes sense. So I think we covered quite a bit today.
Yeah.
That was pretty easy, right? So I think we're probably getting close to an hour, so we probably should kind of wind this up. Emily, if there was any kind of parting tips that you would give to somebody we'll tie that into some of the things that you really specialize with, knowing that we've got a thyroid kind of centric group, people who have thyroid issues, and you're kind of work with people with hypothyroidism challenges anyway, but key with ketogenic and with pregnancy issues. What would your parting kind of advice be for somebody if they're listening to this podcast of things that they could do or should do? Maybe the top 3 things if they're trying to get pregnant and they have hypothyroid issues. What would be your recommendations?
So that's a great question. So recommendation wise, definitely diet. Make sure you're eating a good, clean diet. And if you're still not getting to the point where you're understanding, or if you're hypothyroid, you can't lose this weight, the first thing I would say is start tracking your food. Start just tracking so you know what you're consuming. You're getting information. So one of the things I like to use, it's free, is called an app called MyFitnessPal. There's a upgraded version, but man, save the $10, get the free app. Start tracking what you're eating so you know what you're putting in your mouth. So if you do go see a practitioner somewhere, they can look at that and they can say, wow, there is a trend here. We're seeing some issues. So that's one of the biggest things, that I would say is track your food, eat clean, and sleep. I think sleep is absolutely huge. Make sure you're getting good quality sleep. Make sure you're consuming water. Water is a huge, huge player. It makes us live, so that's huge too. So I would say make sure you're getting, and we didn't really talk into depth with sleep and drinking water, but those are some basic things that you can do. And that's the thing is, a lot of times when people come see a functional medicine doc or a practitioner, they'll be overwhelmed. They have all these health issues going on, and they're getting dumped on with all this information. It's like, oh my gosh, I have to change my diet. I have to take all these pills. I have to do this. I'm already overwhelmed. I already have 3 kids and I can't function. So it's a healthy balance. One thing at a time. You don't need to do everything. Pick one thing and stick with that change for the next week, 2 weeks, whatever that fits you, whether it's tracking your food, increasing your water intake, or making sure you're going to bed at a decent time.
I think those are all good points. And I think that's one of the big things that most people need to understand, the difference between conventional medicine and functional medicine. In a conventional medicine model, really you're going in You're telling them what your symptoms are, you're getting something and you're leaving, and you're only coming back for maybe an upgrade of your prescription or to tell your doctor, hey, this isn't working. In functional medicine, our patients should, and people coming to see us, should expect this to really become a relationship. We're not going to work, it's really not going to be a one visit for most people. It's going to be repetitive visits because we have so much that we need to work on with people. We have to get them to change their dietary habits, their lifestyle habits. What do you do every day that's creating the stress and these health issues? What are your sleep habits? Do you sleep through the night? Do you have quality sleep? Sure I do. Okay. How do you know? Well, I don't. Do you snore? I don't know. I don't think so. Well, have you done any type of testing to find out? Sleep is huge. And a simple thing that Dr. Eric and I have talked about before, and our buddy Mike Mutzel talks about, is mouth taping. And, I do it. And when I don't do it, last night I did not mouth tape, and I thought I had a great night's sleep, and my Oura Ring app says I had a lousy night's sleep. And I'm thinking, man, I thought I had a good night's sleep. I had 2 or 3 good nights. I didn't put the tape on last night, and it tells you I had a bad night's sleep. So it's simple things. Healthy breathing strategies, emotional stress, all those things have to be worked on. And if we tried to give all of that advice in one visit, our people that we're helping are going to be overwhelmed. So I'm sure you, Emily, and I know Erica does the same thing. We're creating a relationship. We don't necessarily want to see you every week for the rest of your life, but we do know that those first couple months of the relationship requires a lot of attention for a lot of people to get them out of their bad habits, to get them out of their kind of that stinking thinking that's going through their head that I can't do it. They see the obstacle and turn around instead of seeing the obstacle and look for the ways to get around it. So I think that's key. So all those 3 things you said are really important, but they're not always going to happen in one visit, right? Mm-hmm. Nobody makes that change on the dime.
That's true.
So that's great. So Emily, why don't you tell people where they can find you if they want to reach out to you and get some of your expert advice? Where would they find you?
Yes, you can find me. I'm in St. Louis, Missouri. And you can also, if you want to check me out, go to the website. It's Enlighten Functional Medicine. And it's enlightenstl.com. That's my website. I have a blog that I'm trying to get more information up there, right, when we get time. And just, I do, complimentary meet and greets to see if we're a good fit for each other. And I encourage you to ask, talking to the patient base out there, call the docs that you're interested in working with, call them and ask them for meet and greets if they do those as well. But I'm in St. Louis, and my practice is Enlightened Functional Medicine. I'm just right outside of St. Louis. So
awesome. Fine. Well, we appreciate you coming on. It was an easy hour, piece of cake. We'll have to get you back on and dig a little bit more into mitochondrial function and the ketogenic diet. By the time we get you on next, you'll even be more well-versed on that than currently. And that happens to all of us, right? What we know now is a fraction of what we find out we should be knowing, later on in the future. Mm-hmm. As always, Dr. Erica, it's great to do the podcast with you. And you can remind everybody where they can find you.
You can find us on Facebook at Brain and Body Health Center, and then on Instagram at Doctors Riggleman. And then our website is brainandbodyhealthcenter.com.
Awesome. And my website is chronicconditionrecoverycenter.com. I have the thyroidproblemsdoctor.com website. And you can find me on Vimeo and YouTube with my Thyroid Thursdays. And I'm just released another one this morning at 10 o'clock. Okay. Mm-hmm. So, thank you so much, Emily, for coming on. We appreciate it. Hopefully we get you back on. And if you are listening to this and watching it, and however you're seeing it or listening to it, if you like it, go to iTunes. Please put some positive reviews on there so we can stay on iTunes and more people find us. So thanks so much, Emily. Dr. Erica, always good to see you. Yeah. And look forward to another podcast in the coming weeks.
Yeah.
Take care.
Awesome. All right. See ya.
Bye-bye.